Have you ever heard a doctor or nurse say the word bradycardia and wondered what it meant? By the end of this video, you'll know how to break down bradycardia and understand it. This is a word that is used every day in healthcare, so you are likely to encounter it in a medical chart or a nursing report or as a patient. The term again is bradycardia. In medical terminology, words are built using three primary components: the prefix, the root, and the suffix. Understanding these will help you easily translate complicated medical words. Here's how they break down for bradycardia. First, the prefix brady means slow. It indicates that something in the body is happening slower than normal. Next is the main word, or the root, card, meaning heart. Finally, the suffix at the end is ia, which means the condition of. Bradycardia literally means the condition of a slow heart rate. Where did the root word come from? The root card comes from the Greek word cardia, which means heart. What does bradycardia actually mean? Bradycardia is the formal medical definition for a resting heart rate that is abnormally slow. For a typical adult, a normal resting heart rate ranges between 60 and 100 beats per minute, abbreviated as BPM. Bradycardia is defined as any resting heart rate that is below 60 beats per minute. However, healthy adults and trained athletes often have resting heart rates in the 40 to 60 beats per minute range with no issues. So it's usually only treated as a clinical problem if it causes symptoms, meaning the heart rate is so slow that it fails to pump enough blood to the body. Some examples of symptoms could include dizziness or lightheadedness, fainting or near fainting, feeling very tired or short of breath. That is the breakdown of what it means when the heart beats too slow, a condition known simply as bradycardia. If you found this video helpful, please be sure to give it a like and hit the subscribe button for more content like this. And if there's a medical term you're curious about, let me know in the comments. Thanks so much for watching, and I'll see you in the next video.